Earlier in the show, our doctors explored treatments which help with common symptoms of the menopause, but for some, the change can also lead to an ageing complexion. Here with his cosmetic options for women who want plumper skin, please welcome Dr. Dirk Kremer. So, Dirk, you recommend this hyaluronic acid. Tell us what it does.
It's true. It's one very important component in our connective tissue, in our skin, like collagen. Yeah. This is very important. It binds water and gives it some fullness, firmness, and hydrates the skin.
And it occurs naturally then within the body?
Occurs naturally.
So this is an alternative then to collagen?
The thing is, we used collagen in the 80s much more because hyaluronic acid was not available on the market, but it was a bovine collagen product, very high, cows, exactly, very allergenic, and also get metabolized very quickly within 2 months. Patient had to come back for treatment. That's quite expensive.
But also this condition, the sort of sagging of skin, the skin losing its luster, is a classic condition of the menopause.
It's a typical condition, and it is proven that with the change of hormones in the menopause, the skin loses collagen, loses hyaluronic acid, and the skin gets thinner, saggier, and more wrinkly. Right.
Well, earlier today, Dr. Dirk performed a hyaluronic acid procedure on a lady who's going through the menopause. Now, she wanted an additional, plumping up to her skin, but if you're squeamish, when it comes to needles, I suggest you avert your eyes now.
First, I assess the patient and look at their skin.
What I find very hard is that these bits here really age me because they've kind of sunk.
I work out the best places to inject the hyaluronic acid. I then apply numbing cream to the face to minimize pain from the injections. After around 30 minutes, I disinfect the patient's face with an alcohol scrub to avoid infection. I ensure the patient sits in an almost upright position and does not lie down. This would change the depth of her wrinkles before I administer her fillers. I inject under the wrinkle small amounts of hyaluronic acid. Each injection makes a fine thread of filler to give a more natural look.
Now here's what Tracy Collins looked like before the show. And here's what she looks like now. This is Tracy now. Tracy, you've seen what you look like. You've been looking at yourself a long time, what you looked like before. You've seen what you look like afterwards. Are you happy with the results?
Yes.
Why did you want it done?
I've been thinking about it for a year because just my skin had just gone really saggy and doesn't matter what moisturiser I used, and I'm very fit and healthy, but nothing made any difference. But scaremongers kind of put me off having this done.
So how painful was what Dr. Dirk was doing?
Not painful at all.
Really? So you cope with it quite easily?
I think because he's very calm and he talks you through it and explains everything that he's doing.
So where were you injecting on Tracy's face?
Basically, what she didn't like were, she had wrinkles. We did see them before picture.
You've just got little dimples now. It's rather lovely.
It's a little bit swollen. It will settle down. Where we did also treat her marionette lines. Here she was very deep lines and make her look kind of sad. Nasolabial folds, and I put a little bit here in the tear trough, and also this here, the frown line was very deep.
How long will it last?
It will last, depending how quick she metabolizes, 6 to 12 months. But the very important thing is that research has proven that the hyaluronic acid itself stimulates our skin to produce collagen, own collagen. So when the material is gone, she might have built her own collagen.
And the cost?
Starting with £250 for a syringe. And of course, I let people guide me what they want to have, what they want to get for it. But one message again, never use just one tool we have as a plastic surgeon. To fill her up completely full of fillers is always an unnatural result. Use a bit of this, maybe a bit of Botox, then it's very natural.
Well, if you ever consider a hyaluronic acid procedure, don't forget plastic surgery and injections like this. Do your research before you go there. Seek advice from your GP first, then go to a registered practitioner. Plus, if you have a medical question, email us, alan@itv.com, and our doctors will be back next Wednesday to help answer them. My thanks to Tracy Collins and Dr. Dirk Kremer. Just enough.